talk about osteoarthritis, specifically of the knee joint. What is osteoarthritis? It is a degenerative joint condition that occurs over time. As we use our joints throughout our lifetime, we get a lot of wearing and tearing, and over time, the cartilage, which is the cushioning between the joints, is going to rub and wear down. As that wears down, we start to get more of that bone-on-bone approximation, and that's where the arthritis is going to come in. Arthritis is that wearing down of the cartilage and the cushioning is gone, so when you're walking, you're getting bone rubbing on bone. That can be very, very painful. It's going to lead to a lot of inflammation in the joint and pain and stiffness as a result of the swelling. Again, the cause is going to be that wearing and tearing, that breakdown of the cartilage and the reduction of that cushioning between the joints. The bones over time are also going to start to degenerate. And what can happen as the bones start to degenerate and start rubbing over time is you can also get a little bit of a bony overgrowth, which is called a bone spur, which can cause a lot more pain as you're walking. Your knee joint is rubbing, and the bone spur is going to cause more rubbing and more of that bone on bone, more inflammation and pain in the joint. So the symptoms that you're going to get with arthritis: a lot of pain and swelling inside the joint, a lot of stiffness not only in the joint but also in the surrounding muscles. Along with that is you're going to start to lose range of motion in your knees. You're not going to be able to extend and bend your knees as well as you could before, and that's going to lead to a decrease in your overall mobility. You can sometimes get some grinding and popping in your knees too, like if you're standing up from a chair, they might feel a little bit creaky or grinding, and that's just the arthritis, that bone-on-bone rubbing. Over time, what can happen is you might have pain or difficulty getting up from a chair. You might not be able to get up from a chair without pushing off with your hands. You might have difficulty going up and down stairs, your everyday activities, preparing a meal, standing, walking to your mailbox, walking around the neighborhood can become very painful and very difficult. If left untreated, arthritis is going to lead to further joint pain, further stiffness and inflammation, and it's going to worsen over time if you don't get it addressed. And this is going to affect your regular activities, your day-to-day activities, and you're going to become less mobile. You won't want to do the regular activities that you love to do. So one thing that we can do is help address that with PT. Unfortunately, there isn't any cure for arthritis, but it is very easily manageable with physical therapy. So one thing that we'll do in physical therapy is we will do hands-on joint mobilization. So that is making sure that the bones are sliding and gliding the way that they should, decreasing some of that stiffness in the joint, bringing some of that joint nutrition back in, giving a little bit more lubrication in the joint so you're not feeling as stiff and painful. And that's also going to help reduce some of the inflammation in the joint as well. We'll also set you up with a stretching program, so making sure that those tight muscles are getting elongated. You're not going to have as much stiffness in the muscles. Everything will be moving a lot better, much easier to get up in and out of the chair, much easier going down the steps. We'll set you up with a targeted strengthening program. So with your knees, we're going to focus not only on your quadriceps, which are the muscles in the front of the thigh, we're also going to focus on your glutes, biggest muscle in the body, your hamstrings behind the thigh, your calf muscles, and your hips. So really the whole chain of command, making sure that you're able to get up from a chair, go up and down the steps. If you play sports, any leisure activities, any recreational activities that you want to get back to, we're going to do some targeted, specific functional training with you, making sure that you are getting back in the game and getting back to your activities of daily living. For more information, call our office at 703-450-4300 or click the link below.